Hi, I'm Dr. Giles. 20 years ago, I was working in an operating room up in Northern California, but I had developed a really tough problem with a drug that you may have heard of called fentanyl. Fortunately, and probably because I was a doctor, I got to participate in a special program that helped 4 out of 5 of us get sober and stay sober. It's the most successful program of its kind in the world. It's called the Diversion Program, and it's available in all 50 states. I got so excited by the change that even though I went back to the hospital and worked there for several more years, I was captivated by the difference between somebody who used and didn't use. What was the difference? I got really interested in it, and I went on to do some extra training, and I actually changed my career and went to help people with the same problem I had. I came to Southern California, to the Rehab Riviera, and I went to work in these fancy facilities trying to help people get sober. At first, it was really exciting. There were lots of interesting people to help, lots of patients that had all kinds of complicated problems, but also really good people who were trying to help. That was when I started to notice some trouble in the rehab world. After a month, people were happy. They would ring the bell and graduate, and they looked a lot better. But about 9 out of 10 of them, in usually pretty short order and almost always within the first year, would relapse. This happened over and over, and sometimes it was the most heartbreaking thing you could ever see. So I tried to put together the principles of the program that I went to, which was this doctor program, and apply it to the rehabs. But unfortunately, most of them are interested only in the insurance benefits and not so much in the long-term success. There's kind of a dirty little secret in the rehab world: keep coming back. So this method of helping people for the long term wasn't really compatible. So I left and assembled my own team of experts, including doctors and therapists. And we tried to take the doctor information, these diversion strategies, and apply them to regular people. And it worked. Pretty soon, we got to be well known around town, and we were taking care of moms with kids who simply couldn't get away to rehab, people who were big business owners that would lose their mandate if they left work for 30 days, and some pretty famous people who I'm sure that you know, but of course I can't say their names. It was really great, and for the last 15 years, I've helped literally hundreds of people turn their lives around using the same principles that helped turn my life around. The only problem remaining is how to get this information available to folks on a wider basis, because it's expensive to have doctors and nurses come to your home. It's very costly to have them follow you around the country and help you stay sober. But fortunately, we figured out a way that we can bring this information to you and help you, if you're interested, where you are. The new program is called VHAB, and it is an application that you can use either on the computer or on your phone. It's the very same information, in fact, actually better information than you would get in rehab, because it's the stuff that works. It's a series of daily visits with the doctor, and guess who that is? It's me, along with some exercises and some strategic approaches to deal with not just your drinking or drug use, but also with the feelings that you had that drove you to that in the first place. It's a new way of approaching the problem that regards you not as diseased, but as actually in control of your life. We just teach you how to gain control of your drinking. If you're interested in learning more about VHAB, it's still at the developmental stage, but it's going to be released in the next couple of months, maybe sooner. I have built a little tool which you can, if you put your email address in, I'll send it to you, and you can use it to learn more about the program and also to make an assessment for yourself if drinking is something that's starting to get out of control or if your drug use is a little more than just recreational. There's no obligation. The tool is free. It's just for you. You can even pass it around if you like. But I think it's not right that all this information is trapped in the rehab, and it's time to free it up and get it out in the world. So something that's affordable, portable, and private, VHAB, I think you're going to like if you're like me and you are struggling with this problem. In the meantime, this is Dr. Giles saying thank you for your time, and if you're interested in VHAB, please put your email in the box and I'll send you the tool right away, and we'll let you know when it's available. Thanks again.